everyone. Welcome to Community Health Matters. I'm Amy Marsalis, and with me today is Daveisha Moore, who is with Komen, Central Tennessee. So good to have you here today,
Thank you for having me.
Now, we know it's October is Breast Cancer Awareness Month, and you have a personal story to share about your family and why you got involved with Komen. Why don't we start there? I think that's a good starting point when you share a personal
Certainly.
aspect.
So back in 1992, my grandmother was diagnosed with breast cancer, and I lost her that year. But the thing about her story, she actually found her lump 2 years prior to that, but didn't tell any healthcare provider or our family. So by the time she went in for a routine doctor's appointment, my mother was there. The mass had actually grown outside of her skin, and by that time it had spread all throughout her body, and we lost her. So as I grew up, I just had that on my mind, what could have been different. She believed breast cancer was a death sentence, and that's not the truth now. And so with education, you know, we can really combat some of those misconceptions. And so as I grew up and got into public health and started working for Susan G. Komen, I keep her on my mind. We joked about me not wearing pink today. Royal blue is my grandmother's favorite color. So, you know.
That's really special. And you have pink lipstick on.
I do have pink on lip.
Camera picks that up because that's in honor of Breast Cancer Awareness Month.
Certainly.
Well, that's neat to know the background on that and how wonderful, you know, what a legacy and what a tribute to your grandmother. Okay, so in your role, you are trying to address the disparities, aren't you, in the diagnosis, in the treatment of breast cancer in certain populations. Expand on that for
Certainly.
us.
So one of my main roles is the community outreach and education portion of our goal at Komen. So I do a lot in planning of community events and making sure that women out there know the signs and symptoms of breast cancer and know the resources that are available to them. And also overseeing our grant making process. We actually give grants to other organizations to make sure that women in our area who don't have financial resources and access to care can get those through programs in the community.
We know that the numbers, 1 in 8 women have a lifetime risk of getting breast cancer, and we know that there are so many good treatments for women if they're diagnosed early, but the screening is really key, and there are again disparities there in women getting to a screening mammogram. And again, why is that? Can you draw attention to those areas?
Sure, and I will say that Komen in September came out with this new big bold goal, and it is to decrease death rates in breast cancer by 50% over the next decade. And we do know that 1/3 of those deaths could be prevented if people just get to screening in a timely manner. So we know that because of lack of access, uninsured women, geographical location, they can't get to screening, so we really try to rural areas. We have one county that we serve, they don't have any places to get a mammogram, so we really look at those issues and try to address those, and again try to connect women with treatment and resources.
Do you think too with older women too, like when you speak about your grandmother and her fear and letting it go longer than maybe she could have or should have to be treated, is that something you run into often with an aging population, more than women your age, for example?
Certainly, there's several things. You know, older populations weren't as educated at younger ages about breast cancer awareness, and there's still the misconception that breast cancer is a death sentence and things like that. So we also have run into issues that some women that are over 60 or 70 years old don't think they should get mammograms anymore because they think they're too old. So we do run into those issues and try to educate around that as well.
Some of the most common fears women have about breast cancer education and screenings, as I read through some of the literature preparing for the show, some of these women, not only they don't have access, but they have no child care either, and that can be a barrier as well.
Certainly. And we always talk about, we've done several focus groups that a lot of women are busy working and doing other things for their family, and they simply can't get away from work to go get a screening. And that is a really big issue, and that's why we support some mobile mammography programs in our area to ensure to kind of combat that barrier as well. So.
How is Komen breaking down some of these barriers? So you do have some of these mobile mammogram units, education. Are you teaching women the signs and symptoms, things to look for in their bodies, and
Certainly.
encouraging self-checks?
Certainly, and most women at this point, and we've done so much around awareness, they know about lumps, and even among that, there are still other signs and symptoms that can signal breast
Yes.
cancer. So we go out and try to teach those physical signs and symptoms.
What are a few of those?
So redness and swelling, pain in one spot that won't go away, discharge from the nipple, just to name a few.
So for women who don't have insurance, who don't have access, who don't have resources, what options are there specifically? Is it through Komen that they can find some help?
We are definitely a resource in the community, so anyone needing resources can visit our website or call our office. Some programs that I can mention, the breast and cervical screening program through the State Department of Health is in every local health department. So anyone that's uninsured over the age of 50 needing screening can call their local health department and ask for the breast and cervical screening program. Again, there's a mobile mammography unit that we partner with through St. Thomas that we'd be happy to connect anyone with as well. So.
Daveisha, what about women who are afraid of the pain or what they have perceived as pain from a mammogram? I mean, I know from personal experience, I don't know if you've had them yet, but that it's really not painful. To me, it's not. But how can you allay women's fears?
So, and I know that Dr. Lawson will be speaking about this a little later,
Yeah.
but one of the things that we always tell women, that slight moment of discomfort is worth so much more than the possibility of being a late detection of breast cancer. So as long as we can find it early, there are better chances that it can be treated and a better survival rate.
That is a great point to stop this segment. Thank you so much, Daveisha.
Thank you.
You're doing really good work. Your grandmother would be really proud of you.
Thank you.
Yeah, thank you so much. We'll be back with much more right after this.